Good morning and welcome to another Ministry of Health virtual media conference on the national COVID-19 response. Today we have with us the Honorable Terence Dayal Singh, Minister of Health, Dr. Miriam Abdul Richards, Principal Medical Officer, Ministry of Health, Mr. Ronald Soyafat, CEO, Eastern Regional Health Authority, and Mr. Lana Lewis, Disaster Preparedness Coordinator in the ERHA. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be your moderator for today's media conference. We begin with the clinical and parallel health system updates from Dr. Abdul Richards. Good morning.
Thank you very much, Al. Good morning to the Honourable Minister. Good morning to my colleagues from the Eastern RHA, Mr. Soyafat, our Chief Executive Officer, and Ms. Lewis. Good morning to members of the media, both who are tuned in locally, regionally, and internationally. And good morning, Trinidad and Tobago. Thank you once again for your attendance as the Ministry of Health shares information on our response to the COVID-19 pandemic. This morning, my summary will be in two parts. Firstly, an update with respect to Media Release 915 dated Sunday the 21st of November 2021, and then followed by a brief update on the status of our hospitals in the parallel healthcare system with specific reference to the level of intensive care unit care as well as our accident and emergency departments. So I'll start this morning with a summary update dated 21st of November 2021 as of 4 p.m. yesterday. So as of 4 p.m. yesterday, an additional 404 new positive cases were reported in the last 24 hours. This has taken the rolling average to an increased number of 517, and this addition of cases takes the total number of active positive cases to 8,611. Patients are distributed as follows: 518 in hospital, 108 in step-down facilities, and 7,581 in home self-isolation. There are 92 persons in state quarantine facilities, and these represent returning nationals who are not fully vaccinated. Unfortunately, yesterday, we recorded an additional 20 deaths, and our sincere condolences go out to the families, friends, neighbors, and all persons who are related and have interacted with these 20 persons. This reiterates the importance of vaccination as an additional layer of protection. As we move on to the hospital update, I would like to stress and re-emphasize that the percentage of patients in the parallel healthcare system who are not fully vaccinated, based on data from July 22nd to November 3rd, 2021, continues to be high. That is 91.7% or close to 92% of patients hospitalized in the parallel healthcare system. 5,346 of 5,830 are not fully vaccinated. This is consistent with trends that we have been noting as we have been reporting during that time period. I'd like to now shift and present a summary of the status of the parallel healthcare system at this point in time. And as of this morning, there are 539 patients, representing an increase from yesterday in the hospitals in the parallel healthcare system, and 106 in our step-down facilities. This is the highest recorded number. In our last wave, the highest overall recorded number was 627. I'd like to now move and shift my attention to the trends in the parallel healthcare system. We continue to notice an increase in hospitalizations consistent with the increase in rolling average. More positive cases will result in more hospital admissions. We continue to notice an increased demand of patients who require ICU level care and have been receiving it upon arrival to the parallel healthcare system and our local accident and emergency departments in the traditional healthcare system. On any given day, 11% to 44% of patients require care at an ICU level, and they do receive it by our in-house ICU teams. Our COVID positive patients continue to access the JMRTT ambulance service, in many cases too late. Yesterday, a colleague of mine spent 1 hour in the afternoon trying to convince the relatives of a very ill person to be transferred to the accident and emergency for care. And in many cases, these efforts, as yesterday, are unsuccessful and patients continue to present too late and often decreasing their chances of surviving. We continue to notice high levels and numbers of patients in the hospitals, in the ICU facilities. And this morning, our ICUs are yet again at 88% in Trinidad and at 71% in Tobago. I'd like to now provide an update on the activities the Ministry of Health continues to carry out to increase the capacity to manage these very ill patients and trying our very best to save lives. I'll provide a summary from Wednesday the 17th of November to present. On Wednesday the 17th of November, and as per directives from the Honorable Minister of Health, who continues to meet with the clinical specialist team, ICU, and internal medicine from the traditional and parallel healthcare system, led by Dr. Michelle Trotman and, of course, our Chief Medical Officer, 12 Mindray ventilators, SV300, which are ventilators specific to treatment of critically ill patients with the complications of COVID, were delivered to Trinidad and Tobago and into the hospitals in the parallel healthcare system. The commissioning process started within 24 hours. These ventilators were imported, procured, and approved within 3 working days instead of a usual 1-month period. And this process was initiated by the Honorable Minister of Health based on our meetings. On Thursday, the 18th of November, we increased the capacity to manage ICU care patients based on demand at the Sandy Grande Hospital. Mr. Soyafat will speak on that. And the capacity was increased on that day from 7 beds to 9 beds. So again, an effort. Now, I'd like to just remind the public, it's 2 ways we are increasing capacity. Through the GMRTT ambulance service and improving that process. That happened on Wednesday and the interfacility transfer. Secondly, through increasing the ICU capacity at the accident and emergency. Over the last week and on Friday, November 19th, we increased the ICU capacity based on demand at the Eric Williams Medical Sciences Complex at 5. So within the last week, 20 to 27 increased capacity. In the parallel healthcare system, the 12 new ventilators have been assigned to hospitals. And we increased the capacity at the ERHA General Hospital from 13 beds to 15 beds over the last 48 hours. That was on Saturday night. And at the Cuba Medical and Multi-Training Facility, we have increased from 26 to 28 beds this morning. This has taken the total number of ICU beds in Trinidad to 70, with 7 in Tobago, 77. And we do continue to try our best to increase capacity and expand with the additional ventilators. As I close, I'd like to present the increases that we look at within the next 3 weeks. The Cuba Medical and Multi-Training Facility, on a phased basis and based on demand, 2 additional beds followed by another 2. At the Augustus Long Hospital, transition with respect to ICU demand, ward level beds being converted to 5 additional ICU level care beds. The area hospital, Point Fortin, an additional 6 beds. The St. James Medical Complex, an additional 2 beds. And then in Tobago, the process to increase the ICU capacity from 7 to 13. This represents an increase of 17 additional beds and in Trinidad and another 7 in Tobago. I'd like to close by thanking all frontline workers and their supporting teams as the Ministry of Health continues to try our best to save lives. Thank you very much.
Thank you very much, Dr. Richards. We now go to a presentation from the ERHA CEO, Mr. Ronald Soyafat. He will provide an update on the systems in place to treat with any increases in COVID-19 cases in his region. Mr. Soyafat, good morning.
Thank you very much, Al. Good morning, Trinidad and Tobago, and of course, good morning to our Honorable Minister and my colleagues with us this morning. Just to say to you that we have noted in the Eastern RHA, just mirroring the national picture, an increased number in the number of COVID-19 cases presenting and accessing care at our accident and emergency departments at the Sangre Hospital and as well at our district health facilities. Because of our vast geography in the ERHA, we have 3 satellite accident and emergencies: Rio Claro Health Center, Mayaro District Health Facility, and also we have a 24-hour accident and emergency in Toko. At all of these, we are seeing increases. We're doing upwards of 25 swabs per day. It was pressed. It's back on? Okay, thank you very much. And in the Sangre Grande Enhanced Health Center, we're doing as many as 100 swabs per day. The Nariva Mayaro actual cases, we have 215 active home quarantine cases, and in St. Andrews St. David, we have about 380 active home cases under quarantine. Looking at the Sangre Grande Hospital, again, what we have noticed as presented earlier is that patients on entry to the accident and emergency are in fact very ill at this time. And so some of them require high dependency care and intensive care even when they come in at the hospital. So how do we manage this? We start with our triage system. When a patient comes in, we use the Canadian Triage and Acuity Scale to determine the level of illness and severity, and that helps us to assign how we take care. We then move from there very quickly into streaming them into the area of the COVID stream or the ordinary healthcare stream. That being said, we have in fact increased the number of isolation areas for COVID to preserve the separation of our COVID cases from the normal stream cases, so that our accident and emergency is now segregated to provide for that separation. Apart from that, acknowledging the increase in cases, we have provided an extra 16 ward type stroke high dependency unit level beds to be able to hold patients pending transfer into the parallel system, so that we are taking all precautions to cope with the surge as we look at it. Just important to reiterate also that 95% of the people who are presenting that need HDU or ICU are unvaccinated people. So that is a very important statistic that we need to take note of. In terms of vaccination uptake, we've had a dive in the vaccination update over time, and now we are doing very low numbers daily in terms of vaccine. But we continue with our outreach exercises, and as a matter of fact, on Friday we were in the Brooklyn community trying to reach out to the community to encourage. Very importantly to note is that also is that in the ERHA, looking particularly at the North Coast, we have very low uptake rates, from 10% to sometimes 19% of our communities are vaccinated. There's a big implication for this, for the villagers, as well as we are talking about asking for beaches to be reopened and all of that. What is the implication then to our villagers as well as to visitors if we allow this? So we are asking folks to try to come out and be vaccinated. Try to come out and be vaccinated. In closing, apart from that request for asking people to come to be vaccinated, we're just saying that in these challenging times, we need to continue to wear our masks, to wash our hands, and to watch our distance, because this challenge continues. Thank you very much from the Eastern RHA.
Thank you very much, Mr. Sarfat. Next, Ms. Lewis will share some of the measures that are in place at ERHA as we put preparations in place to escalate the national COVID-19 response. Ms. Lewis.
Thank you, Al. Honorable Terence Yelsing, Minister of Health. Dr. Miriam Abdul-Richards, PMO at the Ministry of Health, CEO of the Eastern Regional Health Authority, Mr. Ronald Soyafat, members of the media, viewing and listening public, good morning, and it's a pleasure to be with you this morning. I'm here to share with you a little on how the ERHA has been managing our COVID-19 efforts from the point of view of our Emergency Operations Center. You may have been hearing the term EOC, but before I share those details with you, allow me to share what an EOC is and what it does. An EOC, in its most basic sense, is a central coordination unit that brings together all your key stakeholders who are needed for incident management. EOCs occur at varying levels, and in particular, here I draw your attention to the Health EOC and ERHA's EOC that feeds into the national mechanism through the Health EOC. ERHA's EOC comprises a multidisciplinary team from varying units, including operations, logistics, HR, finance. But also key to note, the reason for that EOC, especially in the ERHA, is that it represents each of our administrative areas. So Mr. Soyafat would have mentioned Sangre Grande Hospital, which is one of our areas that focuses on secondary care. But we also have our two primary care areas. Those are St. Andrew St. David and Nariva Mayaro that concentrate our outreach and health center services, as well as our administrative functions by our head office. That ERHA EOC facility allows us to get a holistic picture on what is happening at any given time so that we can appropriately manage incident management so that we mobilize resources based on needs. So for the ERHA in particular, we've activated our EOC in many occasions, and in recent times we've been tasked with activating and operating our EOC from a healthcare directly management point of view. Our EOC, in the case of COVID-19, was first activated in January 2020 at the time when WHO declared then novel coronavirus, as it was called, a public health emergency of international concern. And what that saw the EOC at the ERHA doing really is coordinating and planning in advance long before Trinidad and Tobago recorded its first case of the virus. What we did as an EOC team, we coordinated very closely with other RHAs and the Ministry of Health and regional corporations. We also engaged in outreach and education activities to get our communities that we serve ready in terms of how you prepare to what is to come to us at that point in time. We also put measures in place to manage supplies because we were paying very close attention to what was happening globally with supply chains. We also had a range of retrofitting and reconfiguring activities taking place at our health facilities so that we ensure we have proper isolation measures in place. In March 2020, we escalated that EOC level to full activation. And the reason for that being two things. ERHA was tasked to manage our first quarantine site in Trinidad and Tobago, and you may recall that's the Balandra quarantine site, but also Trinidad and Tobago recorded its first case of the virus. So since then, ERHA's EOC continues to remain activated to coordinate all our incident management activities so that we ensure we meet the needs of our region and contribute to the national health mechanism. Currently, our ERHA's EOC, apart from doing all the initial things of planning and outreach and coordinating how we manage our resources, we are also coordinating our vaccination efforts and implementing surge measures, which you might have learned from what CEO shared with us earlier. So all that being said, ERHA stands ready and continues to support the National Health EOC and the national mechanism as we not only provide care to our community but support our other RHAs and partners through the Ministry of Health in ensuring we have an effective response and speedy recovery. Thank you.
And thank you very much, Ms. Lewis. I now hand you over to the Honorable Minister of Health.
Thank you and good morning, Al. Good morning to Dr. Richards, CEO Soyafat, and Ms. Lewis from ERHA. Ladies and gentlemen of the media, the viewing and listening public, wherever you are, good Monday morning to you. Let me bring you up to date with the vaccination numbers. These are figures as of the close of play on Saturday. Yesterday's numbers will come in hopefully during the course of the morning. So as at Saturday, close of play, first shots, 637,616. which represents about 45.5% of the population. Second shots, those on the way to being fully vaccinated, depending on if you got it 2 weeks ago or the fully vaccinated, 635,055, which is about 45.4% of the population. Ladies and gentlemen, you would have noticed we started the conversation last week about the EOCs, the Emergency Operation Centers in the different RHAs. What we started to do about 2 weeks ago, looking down the road where this current wave will take us, is that we took a decision that the EOCs will now be managed centrally at the Ministry of Health under the directorship of both myself and Ms. Patty Ann Williams. This means that all 5 RHAs, TRHA and the 4 RHAs in Tobago, will now be coordinated from the Ministry of Health. This is a useful tool in an emergency or crisis, whether it's a disaster in the form of a natural event like a hurricane or earthquake, when you are managing mass events, mass casualty events. It helps us to manage scarce resources, find scarce resources, and it also enables us to work with other state and non-state actors like ODPM, the Army, the TTPS, Red Cross as a NGO, and so on, to find resources at short notice, corral these resources, and send them to where you have an emergency to either mitigate risk or prevent something untoward happening. It is this approach that we used this weekend. Dr. Richards would have told you that we were able to set up, is it 13? 13 new ICU beds this weekend. The only way we could have done that is with coordination from the Ministry of Health. And I want to thank Dr. Richards, working with me night and day from Wednesday, Thursday, Friday, Saturday into Sunday on all the RHA, because we pooled all the resources. It is only because of that approach, managing this thing centrally over a 96-hour period from Wednesday into Thursday, Friday, Saturday. By Saturday night, we were basically finished. We were able to save about 7 to 10 days in operational time, which will be the normal rate of bringing up these ICU beds in a non-emergency system. So many of us worked literally night and day to bring this to a reality. With that, our ICU capacity, because this is what we are seeing now, patients are presenting late. You would have heard Dr. Richards say, one doctor had to spend 1 hour to convince one person to come into the system. And that is playing out across the country. And when these patients make that late decision, they place this burden on us for advanced care. So that is what we have been doing. This process to ramp up ICU started about 2 or 3 weeks ago, Dr. Richards, I believe, when we met with all the stakeholders across all 5 RHAs. So that is the sort of activity plan we've been having. This just gives you one example of how a centrally located EOC now, Emergency Operations Center, at the Ministry of Health is going to be managing this new wave of infections going forward. Before I close, I just want to ask the public again, as we have been asking, if you are symptomatic, please come into the parallel healthcare system early so we can have less deaths, less use for ICU space, less ambulance trips to your home, because very often the ambulance has to go 2 and 3 times to your home. So work with us, and if we do that together with the 3 Ws and vaccination, you know, we can have a greater impact on these, you know, high numbers of mortality, which quite frankly should be unacceptable to each and every one of us, because these are families that are plunged into mourning and our deepest condolences go out to all the families who have been affected. Thank you very much, Al.
And thank you, Minister. We'll now take questions from the media. We are reminding the media that we ask you to state your name and the name of the media house that you represent before asking a maximum of 2 brief questions. We begin with AZP News.
Good morning, Private Harry, EZBnews.com. My 2 questions are for the Minister of Health. Good morning, everyone. Minister, we have had the vaccination program going on since April. You said last week that it has stalled. The Secretary of Health in Tobago said last week said that Tobago averaged about 25 shots a day, and therefore the vaccination program is not working, and we are in the middle of a wave. Some countries in Europe, for example, they are now going into more lockdown where the population, have been vaccinated and they have reached herd immunity. Therefore, are we going to the ministry now going to do something different in terms of policy? What is the way forward? What else is it going to try something to do differently? My second question: a lot of positive COVID-19 patients, they are being treated by private institutions. They apparently get their care at home. Is that something that the ministry has approved? Has the ministry sanctioned that? And is it okay for people to do that? Thank you very much.
Thank you. Thank you very much, Prior, for your 2 questions. So moving forward, the policy of the government remains basically the same in that we encourage people to be vaccinated. The vaccination program is voluntary. We ask people to come in to be vaccinated, those 12 and over. What we are doing differently and have been doing differently for a couple of months now is actually going into communities. ERHA was here. All ERHAs actually go door to door, mosque to mosque, church to church, mandir to mandir, business to business, in open spaces, car parks, malls, and so on. This weekend, we will be having our final sort of retail establishment drive, which starts, I believe, on Friday, which will take us about the middle of December. But vaccinations will continue throughout 109 health centers. So we continue to have the policy that vaccinations are voluntary, but highly, highly recommended. What we are asking people to do differently is this. In this current wave, it is now imperative that even for the vaccinated, that the 3 W's also apply. Don't let your guard down, even if you are vaccinated, like myself and everybody else in this room. We are all vaccinated. If you are vaccinated as an individual or a family, don't let your guard down at this time. Continue with the 3 W's, the washing of your hands, the wearing of your mask. Very, very important. You see, the mask is probably one of the most important tools. And distancing, especially with this Christmas period. Really, really avoid social gatherings as much as humanly possible. For the unvaccinated, it now means without the extra level of protection that a vaccine gives you, it means now you have to be doubly and more stringent in your hand washing, your masking, your social distancing. It means you literally have to be only outside for really important tasks, like working, going to the pharmacy, going to the grocery, because you are unvaccinated. That's a choice you have made. We understand that. We respect it. We may not agree with it, but we respect it. If that is your choice and you don't have that layer of protection of the vaccine, then you owe a duty to yourself and everyone around you to be even more careful than the vaccinated person. Your second question at the private home, as we said from the very beginning, no private hospital has ever been debarred from caring for COVID patients. There's one that is doing it, and we welcome it. The issue is people accessing care in their private homes, decompensating at their homes, and then turning up at the parallel health care system on the verge of death, refusing to come in, as we said this morning. We have had the examples. Yesterday, Dr. Fraser had to spend 1 hour convincing one person, and that person did not come in. Home treatment for COVID is not recommended at this point in time. It is not recommended. So we ask you, if you are COVID positive, to come in as early as possible. It can save your life. To get tested, know your status, and if you are one of the persons who wish to be vaccinated for that extra layer of protection, please take advantage of the government's vaccination program, which is accessible, free, and convenient. So, Priya, I hope that answers your 2 questions. Thank you.
Thank you very much, Minister. We go to the Express. Express, good morning.
Good morning, Kim Bodram.
Yes.
Hello, good morning, Kim Bodram from the Express. Sorry. Minister Dayal Singh, to ask you to revisit the appointment of Dr. Abdul Richards to the Board of Angostura. We are asking whether or not this is something that would have had to go through the ministry for approval, and if that was done and ministry approval was given. Also, if you find that it is a conflict of interest given Dr. Abdul Richards' other profession in health and issues with alcohol, alcoholism, sugar associated with alcohol, and the NCD issue that's almost a pandemic in itself. Dr. Abdul Richards, if we could, get statistics, maybe the percentage of people who are going into ICU and what percentage of people are coming out unfortunate in terms of the percentage of deaths coming out of that ICU situation. If you could include how many children have died since the start of the pandemic, please. Thank you.
Thank you, Kim, for your 2 questions. So I have been advised the public service regulations do not debar a public officer from taking up a board appointment as long as the appointee can perform their duties, and that has been advised to me by the public service. On your other question about ICUs, as Dr. Trotman would have said, and we have said, remember, ICU care is not linear. It's not that you come in to one end in ICU and you come out, and you could judge clearly the number of deaths of people who survive. When you come into ICU and a Dr. Richards will go in, it's not linear in that you can go to ICU, de-escalate to HDU, re-escalate to ICU, de-escalate to HDU, de-escalate to a ward, de-escalate to a step-down facility. So we have always explained that and have told the population, based on that fluidity in the level of care, the levels of care that one person can access, it is very difficult to give that statistics which you have asked about. I will now turn you over to Dr. Richards to talk about the pediatric cases.
So I'd just like to remind the population that as of this morning, there are 2 pediatric cases within the parallel healthcare system. One of those children is unfortunately in the intensive care unit, and this reiterates, given the recent unfortunate and sad demise of a child that was reported on Saturday, this reiterates the need for those of us who are in contact with children, especially under 12, to please take up the offer of being vaccinated. We need to be responsible adults and protect these children from acquiring COVID-19. So thank you very much for your question.
Let me just reiterate here, and this is the basis, Kim, and thank you for raising the issue of herd immunity. Herd immunity is there not only to protect those who are vaccinated, but also to protect those who are unvaccinatable. So right now in Trinidad and Tobago, children 12 and under cannot be vaccinated. So what you want is a herd, the rest of us that makes up the herd, which is vaccinated, to protect those who cannot be vaccinated. So right now, we only have about 45% of that herd that is vaccinated, and until that goes up significantly, and that is why we keep saying the choice to be vaccinated is not only a personal choice, it is also something that you have to do as part of a society. And I always use the example, yes, I have rights, but I don't have the right to drive south on the northbound highway coming to Port of Spain. I don't have that because I have a duty of care to the others to protect them from my decision to break the law. So the issue of protecting those 12 and under right now really falls on the 12 and above as the herd to be vaccinated until we have a vaccine available to vaccinate those who are currently unvaccinatable due to age, or for they might have an allergy to some vaccine, some medical reason. So we need to get more people vaccinated, long and short of it. Thank you very much, Kim, for raising an important issue.
Thank you very much, Minister. And at this time, we want to invite the media to also present questions. You can pose your questions to our other presenters from the ERHA, and especially on Emergency Operations Center. Please feel free to pose questions to our other presenters. We now go to the Newsday. Good morning.
Good morning. This is Paula Lindo from the Newsday. I have one question for the Minister and one for Dr. Richard. The first one is, has the vaccination rate increased in response to the increase in the number of daily cases and deaths? Someone gave the update for Tobago, but nobody gave us how many people are taking the vaccine on a daily basis.
How many persons are taking the audio is really poor. Okay. Next question, please.
Could you give us some further details on the child who was reported to have died on Saturday? Were they male or female? How old were they? Were they vaccinated? And were they in the ICU prior to their passing? Thank you.
Thank you. So I will give the thank you for asking the question about the daily rate of vaccines. So for the past 2 to 3 weeks, Monday to Friday, we have more or less been consistent of about between 6 to 800 a day first doses. When you add the Johnson & Johnson uptake, which is around 3 to 400, you have roughly Monday to Friday about 1,200 per day of people accessing the first dose of a 2-dose vaccine on their way to being fully vaccinated, and the Johnson & Johnson 1 dose on the way to being fully vaccinated. That has been the trend for the past 3 weeks or so, Monday to Friday. Yes, and Saturdays and Sundays, obviously the figures drop a little bit. So those are the kind of rates we are seeing now, consistently about 1,200 per day. The extra deaths that we reported last week, Saturday, did not seem to have a lasting effect. That Monday, it did go up by about 200, but then by the Tuesday, drop back down. So we urge people, let us each do our part together to decrease these mortality figures that we are seeing not only in Trinidad and Tobago, but in many other countries, by simply making the correct decision to be vaccinated. Thank you, Paula, and I'll put you on to Dr. Richards to answer the other question.
Thank you, Minister, and thank you very much, Paula. Due to patient confidentiality, the Ministry of Health is unable to provide details of the deceased child. Again, we would use this opportunity to extend our condolences to those parents who are undergoing this grieving process. And again, I'd like to reiterate the need for personal, social, and civic responsibility, as the Honourable Minister has been stressing, in being vaccinated to prevent or to reduce the transmission as well as the severe complications of vaccination. Also, please, again, based on the feedback from my colleagues last week who represented here from the RHAs, we are again appealing to you that if you are COVID positive or you are suspected of being COVID positive, especially given the community establishment of the Delta variant, as Dr. Hines has been saying, please access and seek medical care within the parallel healthcare system. And lastly, we continue on a Ministry of Health response to try our utmost best to increase the capacity to manage pediatric patients across our hospitals. Thank you very much, Paula, for this question and allowing us to share this information again.
Thank you very much, Dr. Richards. TV6, we are ready for your questions.
Hi, good morning to everyone on the panel. Alicia Boucher from TV6 here. I have one request and two questions. I'll put a request forward first. If the statistics are not available at this time, can it be presented at a later date? Can we get that culmination of how many children have died since the start of the pandemic to
You have that?
now? And my two questions. Minister, the first question is for you, just so that we have an appreciation of what is just one of the most important tools to creating an ICU bed, which would be the ventilators. Can you give us the cost of each of those? What was the cost for one of the ventilators? I know we got 12, and the overall cost that it would have cost to import these 12 ventilators. So that's the first question. And Dr. Richards, second question is for you. You said people are coming in late. So I'm guessing that for some people, they don't know what are the early signs that the persons at home who are COVID positive might actually need hospitalization. Can you just tell us what are those early signs and what those persons at home need to look out for to know, hey, let me just get my relative to the hospital? Thank you.
Okay, good morning, Ms. Boucher. I would take both questions based on the nature of the question. Yes, we can provide the statistics for the total number of pediatric deaths, and this can be obtained through the corporate communication department because I do not have it on hand right now. And of course, I would like to present an accurate figure to you. The second part of your question dealt with the ventilators and the recent importation of these 12 ventilators. The average cost of these ventilators, which of course are high-spec invasive, non-invasive ventilators, specific to COVID ICU patients, and subsequent to the request made by our ICU doctors and the team led by Dr. Trotman, was approximately 1.8 million TT dollars. There was no cost to the Ministry of Health in transporting these ventilators because with the cooperation of the Ministry of National Security, the Honorable Minister of National Security, the Trinidad and Tobago Air Guard, given the emergency and part of the EOC response, flew across to Guyana to obtain these 12 ventilators that were in stock by a Trinidad and Tobago supplier. So we appreciate the support of the supplier. Of course, the procurement was done in line with Ministry of Health and RHA standards, and the Trinidad and Tobago Air Guard, which are mobilized within 24 hours to make all arrangements. Yes, thanks again for raising the issue of patients accessing emergency care within a delayed time frame that is often deleterious to their health. So a COVID positive patient has a risk of rapid decompensation and deterioration, especially if they are not fully vaccinated or there are comorbidities. We have noticed in this latest wave, persons are clinically more ill. That is, they are presenting in a state that requires ICU care. And this is a trend we've noticed for 36 days now, consistently, every single day, reported by all our accident and emergency physicians, as well as all of our parallel healthcare system specialists, who the Honorable Minister and myself speak to on a daily basis, and where we've been doing site visits, especially over the past week. Some of the signs of decompensation would be, number one, an increase in the respiratory rate. So someone and a patient would tend to be breathing much more rapidly and shallow. Now, we have given patients what are normal indices, normal respiratory rates, and we tell them to time this. It's something that can be done at home. Secondly, an increase in the person's pulse, anything above 100 beats per minute. Again, very easy to be timed at home. Patients also have pulse oximeters, and we again give them figures. So if they are breathing on room air, which most of them are, you will notice a fall in the SpO2 or the oxygen concentration. Then there are other signs like a fever. Again, can be monitored and measured at home. Decreased consciousness, decreased energy levels and fatigue. So there are signs, clinical signs, as well as symptoms that our county medical officers would have informed patients about, right? There's also, of course, the typical symptoms that we always hear about: loss in taste and a loss in smell in the initial stages. So our health team continues through the county medical officers of health, who are primary care physicians, our ambulance service, the JMRTT, and our ambulance transfer specialists. Because when you call and contact the JMRTT and they come to your home to assess you, a specialist team is called, specialists, consultants, and they assess the patient and determine the need for transfer or home isolation. So I hope that I have reiterated and stressed for the members of the public the need for immediate care in the parallel healthcare system based on the clinical nature of this virus, which continues to evolve, the signs and the symptoms and the processes for seeking care. Thank you very much.
Thank you very much, Dr. Richards. We go to TTT News. We are ready for your question.
Good morning, everyone. Kimberly D'Souza, TTT News. My question is for Minister. Minister, over the weekend, I saw an article from NHS in the UK. They're basically saying that COVID-19 is like smoke and that it hangs around in the air. Do you know if there's any validity to this? Do you know if the ministry is going to add this to its public information platform or program? Because I know that we're in a tropical climate and we do love the AC. So do you know if there's any validity to this?
Thank you. So Dr. Parasram put it, I think, most brilliantly on Saturday. Thank you for asking that question. Dr. Parasram said, and I quote, as much as I could quote, he said, if people could see COVID-19 in the air, in the atmosphere, see it on a person, see it on a hard surface, we will all act differently. The message is, we should pretend that COVID-19 and the Delta variant is everywhere around us. Once you do that, whether it's in the air, a hard surface, on somebody you want to hug and kiss, and you take the necessary precautions, we could come out of this. The research has shown from very early that aerosols play a role and that the virus could actually hang in the atmosphere. So all the regular public health care guidelines are applicable. Pretend that COVID is all around you, on everybody, on every surface, on every glass, on every plate that you take lunch in, outside, in the atmosphere, and just take the necessary precautions. And at the end of the day, if we get vaccinated in higher numbers, all this mortality that we are looking at can be decreased. Thank you.
Thank you very much, Minister. We go to AZP for a follow-up question.
Good morning again. I wanted to follow up on Kim's question about the appointment of Dr. Richards to the Board of Angostura. Minister, Angostura is in the business of making alcohol, and therefore that does not align with the Ministry of Health. So therefore, on what basis was she given permission to be on the Board of Angostura? Thank you.
Thank you. On the basis that the public service regulations do not debar it. And I have cleared that with the permanent secretary.
Thank you very much, Minister. We go to Express for a follow-up question.
Good morning, Kimbo Dram again.
Morning,
Minister,
Kim.
hi again. Just to clarify, earlier you mentioned you said the word wave, and in fact, I had wanted to ask, are we in a fourth wave? I don't know if my figure is correct, or are we in another wave And what figure would that be?
Thank you,
If
Kim.
so.
So we are actually, and I've confirmed this, we are in our third wave. If you would recall, we had our first big wave last year, August, September, coming into October. Then mercifully, by November, December, January, it is okay. Into March, and then we had another wave in June, July. Then it went down, as Dr. Heinz's figures will tell you. And now we are back up in our third wave at this point in time. I think our rolling 7-day average is 588, over 500 plus. So we are, according to the epidemiologists, we are in the grips of our third wave. Some countries abroad now are in their fourth wave, and that is what we are battling with around the world. Different waves hitting different countries at different times. Yeah, so I hope that answers your question, Kim.
Thank you very much, Minister. Express? Oh, sorry, that was Express Newsday, please. Newsday?
Hi, good day. Sorry. So my question is, the CMO said on Saturday he would collect information as to which vaccines were taken by.
Just we're really having some problems hearing you. Just speak a little slower so we'll be able to catch what you're saying.
Do you have the information as to which vaccines were taken by the 56 fully vaccinated people who died?
Okay, so the CMO and Dr. Hines, they have answered this question numerous times. As they have said, the vaccine that is most widely used in Trinidad and Tobago is Sinopharm, over 40%. Second is AstraZeneca, I believe. Third will be Pfizer, and fourth will be Johnson & Johnson. So that will be evenly spread. It does not mean that these vaccines are less efficacious. Those are just the statistics. What the statistics tell us is that 97% of those who die are unvaccinated. Okay? Hope that answers your question.
Thank you very much. And finally, we go to TV6.
Hi, good morning. Again, Alicia Boucher from TV6. Minister, I just wanted to ask a quick question. Seeing that there are people that require that third primary dose, and the ministry, health officials have stated that they are not considered fully vaccinated. Well, they would not be now considered fully vaccinated unless they get that third dose. How does that have any bearing on your safe zone policy? Would persons who had, let's say persons over the age of 60, who had their 2 doses of Sinopharm have their vaccination card, would they still be able to access safe zones even though they're not fully vaccinated until that third dose?
Thank you very much. If we could put up the additional primary dose poster, please. It's a good opportunity to walk it through. So, Alicia, the short answer to your question, for the purposes of your safe zone, because you asked specifically about that, if you have 2 doses of any of the 2-dose vaccines or 1 dose of Johnson & Johnson, you are considered fully vaccinated. The science is evolving as to whether do we have the slide that we could put up? I'll ask for it in case. The science is evolving as to whether fully vaccinated means a third dose of a 2-dose regime or a second dose of a 1-dose regime. But to answer your specific question about the safe zones, once you have 2 doses of a 2-dose regime or 1 dose of a 1-dose regime, you can go into your safe zone. It is also considered to be fully vaccinated for travel purposes at this point in time. Things can change. I just want to reiterate what the additional primary dose is about. For those who receive the Sinopharm vaccine, all persons over 60, regardless of your disease state, you can come in for your vaccine. There it is. The RHAs will call you. The additional dose is recommended to 3 to 6 months after, or the soonest. For Sinopharm again, once you are moderately or severely immunocompromised, regardless of age, An additional dose is recommended. Same thing for AstraZeneca, Pfizer, and Johnson & Johnson. Once you are moderately to severely immunocompromised, regardless of age, and I just want to correct myself this morning, I was being interviewed on 95.5. And I think I forgot to say regardless of age for AstraZeneca, Pfizer, and Johnson & Johnson. And what are the conditions that we consider? Persons with active cancers. If you can leave this slide up, please. Persons with active cancers, that is active solid tumor cancers, blood cancers, you're on immunosuppressive drugs. This does not apply to people who are in remission, as Dr. Asante LeBlanc will have said. Transplant recipients, because you are on immunosuppressive drugs. Persons with immunodeficiencies, example, chronic dialysis patients. Patients who are HIV positive with a CD4 count of less than 200, and persons on immunosuppressive therapy. Other conditions like asthma, diabetes like myself, hypertension are not considered as conditions that will qualify you for an additional dose. I have taken AstraZeneca. I am diabetic, but being diabetic does not lead me to be considered moderately to severely immunocompromised. Same thing for asthma, same thing for hypertension, right? And all you have to do to access the third dose, if you fall into those categories, is simply bring a referral letter from your doctor, your specialist, your team of doctors. Dr. LeBlanc, Dr. Hodge was here explaining all this. We had Dr. Bisamba explaining all of this. This information is up on our website. It's on social media, and we have printed it in the daily newspaper, so it's widely available as a good reference document that anybody could go to see if they fall into these categories of persons, right? Thank you very much.
Thank you very much, Minister. Ladies and gentlemen, we have come to the end of today's media conference. And as Dr. Parasham stated at Saturday's media conference, it's time for the public to once again focus on the basics to protect oneself from COVID-19. Please take the COVID-19 vaccine as soon as possible. Wash your hands or sanitize often. Watch your distance and please wear a mask properly at all times, including while in office, and even if you are visiting, if you are at home and you have strangers at your home, please wear that mask. Thank you for viewing, and goodbye for now.